And now we have Dr. James Nyoro, who is the former governor of Kiambu County, to just give us that perspective of what could be bedeviling Kiambu County, while others are saying dissolve it, others are saying there is no crisis. Good morning.
Morning to you.
Yes.
Thank you for having me.
Yeah.
Yeah. Well, it's so interesting that whoever you talk to, you get a different story.
Yeah.
Right.
In the meantime, when two bulls fight, it is the grass that suffers. I think an industrial action is very inevitable. We all have lived with it. I've probably had 4 attempts during my time, because I'm referred to as COVID governor, because I became governor when 1 month then COVID broke out.
Yes.
And I managed COVID for almost 1.5 years. And I went through many attempts of industrial action. So industrial action is inevitable. 139 days ago, there was an industrial action. There were disagreements between KMDPU and the county government. The kind of thing that you're hearing today is you really get to a point and ask yourself, if we cannot even agree on whether the services are being rendered or not. The governor goes out, he visits some hospitals, and he says everything is working. Yeah. People who are working very closely in those facilities are saying things are not good. Patients are being turned away, others have died. The national government is saying they have figures. The COG the other day said, no, people have not died. So the question really is, when the industrial action took place and there were disagreements, why is it that over the last 139 days, we cannot even have an arbitration? An arbitration to, just get facts. Is there a problem? The doctors listed about 6 items of their concern. I think we all are aware of those conditions. The county government responded, and there have been this, push and pull. So in the meantime, people continue to die. People continue to suffer. The other day we had that Kenyatta National Hospital is suffering because of additional patients coming in. So the question really is, why can't we have a third party? And I've communicated that. I've put it in my Twitter page. I've put it on my Facebook. Why can't we have a third party that can come and arbitrate? And we know it may not be CS Duare, because people will say that he's biased, he's in national government, but health, like he has said, is a national concern. It is provided for in the Constitution, access to health. We hear of the Senate Committee of Health. Last week, we heard that they were in Busia. I think we all saw that they were in Busia. The other month, they were in Nyoro. Why is it that the Health Committee of the Senate cannot come to Kiambu and establish the facts and then try to arbitrate and say what the agreement and disagreements are, so that we bring this to a halt? Why is it that the County Assembly of Kiambu, unfortunately, it seems to be in line with what the governor is saying, whereas the county government is, the county assembly of Kiambu is supposed to be, the one that arbitrate, but also oversight.
Oversight, yes.
So really, the people of Kiambu are suffering because we do not see any of these institutions getting concerned and wanting to come up with a solution.
I'll ask you, as a former governor who's privy to the politics of whether it's the medical practitioners and dentists union, of county government itself, of national government, I don't want to say who should we believe, but even as far as numbers, because that's one thing we've really struggled with. It's just getting fact-checked, verifiable numbers that align. Who should we listen to? We had the chief health officer here, came give us his number. KMPDU are giving us numbers for maternal, infant deaths and things like that. And the numbers are staggeringly different. It's not a different or 1 or 2. It's like 53 versus 136 in the month of September. And you're thinking 53 deaths is a lot a lot of babies. 136 is even more staggering. So who should we listen to for even the basics of what is happening here, the numbers, and then the basis of the issue in Kiambu with healthcare? Who should we listen to?
You see, when you listen to the KPDU, and then you listen to the county governor, you listen to the county assembly, you get the impression that nobody is speaking the truth. In a situation like that, I would say every death is marked by a death certificate. It is marked by a burial permit, because you cannot bury until you have a burial permit. So this information should have come from the national government leading. It should be the national, and it is good that C.S. Dware is now saying we have the figures. He has not told us what the figures are.
Exactly.
But this is the responsibility of the national government to be able to come in and say, is it 56, is it 130, whatever, but even if it is one, even if it is two, why would we be arguing about dead bodies as if they are goats? You guys were talking about goats here before. Why would we be, even if it is 3, 4, 5? So to answer your question, Miriam, the responsibility lies with the national government to be able to come in and first of all establish whether indeed there are those deaths, and two, establish, because we are just being told about children, we are not being told about mothers, we are not being told about other patients who have non-communicable diseases like diabetes and dialysis who have been suffering. It should be the responsibility of the national government to come in and establish the fact, and then develop a way forward, like I'm saying, say, what is your issue? Exactly what has been happening. You mentioned about Israel and Hamas and whatever. Is this has been you hear both sides, and then you come up with a way forward. So if you ask me, the responsibility totally lies with the national government to stop this.
Is there a role for the Council of Governors? Because there's a health committee of the Council of Governors, right? Until recently, it was chaired by the governor for the Rakanidi. But there's a leadership in the Council of Governors. Is there a role for the Council of Governors?
There is a role.
Played a role in previous industrial actions.
There is a role. But if you look at the previous similar cases, we had an instance in Laikipia. I think we had another instance in Kirinyaga. Remember that governors are members of Council of Governors. They are members. And even the statement that was made by COG, you realize that later on they are saying they are having a meeting tomorrow. So you wonder, how did they make that statement
before the meeting?
Before they had the meeting. Okay? So I would say that Council of Governors is there. I do not think that one of the rules is to ensure that they put sanctions or they make the governors work. The Council of Governors, particularly those committees, I chaired the Committee on Agriculture, the Council of Governors. It is more to raise issues with the national government rather than looking internally. Internally, the governors are completely independent, and they would only come to support one of their own rather than them putting in some punitive or some directions that should be taken.
Yeah. You mentioned that essentially it's the national government that the information should come from. So why have they been shy of sharing the information? And even from your own perspective, is there a right time to talk about what's happening? Because we haven't really heard them come out. Like Mariam said, we hosted one of them and they were dilly-dallying with the numbers. So number one, why aren't they saying much? And number two, is it because of some protocol where they can't say much right now?
Well, I do not think that the national government should have any protocol, any problem or any issue on giving out facts on a situation like I said, health is a constitutional provision. It's recognized within the Constitution. And who is the defender of the Constitution? It's not the counties, okay? It's the national government. So the national government should not be shy in going into the hospitals, in going into the mortuaries, in going into wherever to come up with figures. The government should not be shy in seeing that 138 days have lapsed, people are suffering, other hospitals are being congested. They should not be shy in saying, no, We have to sit together and listen to you and come up with a solution. But we don't see that. Now, there is an element here that we need to consider, and which the governor mentioned in the clip that you played, that this is a political issue. Okay? And even if you look at what happened yesterday, where the doctors and a few members of the county were demonstrating, there was a lot of propaganda that was saying that 3 members of parliament had given out some money in order to support the demonstration yesterday. In one of the WhatsApp pages that, from Kiambu, you follow that, which has really been, full of propaganda, talking about all of that. In essence, what are they saying? They are saying that this is a political issue. They are saying that because, remember, the governor and the leadership of Kiambu County, that is all the 12 members of parliament, they nominated the senator, they have not been seeing eye to eye. There has been a lot of push and pull. And the governor believes that these guys are after his downfall. Even when he was narrating in church on Sunday, he talked about the several steps that have been there to bring him down. So there is an element of trying to politicize this issue. But when you politicize the issue, it doesn't matter whether you are the member of parliament or senator or whatever. When you politicize an issue that concerns your electorate, okay, that you will never reverse the death of a child or the death of a mother. It doesn't matter whether, tomorrow you will be friends and today you are not friends. So what I'm saying is that there's a tendency to create an impression that this is a political issue. And things are working well and there is no problem. And even I followed what, the CEO of KMDP was saying, that the county should be dissolved. That even makes it more political. Okay? So, in the meantime, people are suffering. And my strong belief is that we should never politicize health. Health is the starting and it's the head of any service within the county. You can do all the other things well. You can do the ECDs. You can do food security. You can do the roads. But if at the end of the day somebody gets sick and die in the hospital, all the other services will become completely...
It doesn't matter.
They will not matter. So I believe personally that you should depoliticize this. And the way to... And let me say one more thing. Having been a governor, and like I said, we encountered a number of issues. I remember when COVID broke, the first thing that I encountered was doctors coming to my office and saying, we are stopping working. Because, that time we were buying the normal, ordinary masks.
Right.
And they said, no, unless you buy us N95, we are not going to work. Now, those masks were not available. We had to go out, look for them, but we agreed with them. We cannot buy them today, so use those ones tomorrow. By day after tomorrow, we will get them. So we sorted out the issue. We actually did not bring it within a week.
You didn't get them.
But they agreed because we were making efforts to do that. So what I'm saying is these things you cannot avoid. They will always be there. The point really is whenever you have the county leadership not pulling the same direction, you have a big problem. And that's the nature of our politics. If you look at governors who are working closely with the national government, they are actually beneficiaries of a number of programs. And I'll give you an example. Look at where Mashujaa Day or National Days have been held. In Homa Bay, now in Kitui, in other places. There's a lot of investment that is pumped in by the national government. When I was governor, I got 600 million shillings from the national government to put up an additional hospital in Githunguri. 600 million, and towards the end, I pleaded and we got KDF to come and fix it. We got Kirigiti Stadium because of working closely with it. So when you have leadership, in the county that is not pulling in the same direction, it is the county that suffers.
The people suffer.
Yes.
The people are left behind. If you look at all these things, so there's clearly an issue here that is being blown into a political space by both parties, by the governor and by the medics. Because when the medics start saying, no, now let's dissolve, putting figures out there and saying it's for you to come and say those figures are not correct and so on and so forth, there's politicization of it. But why did it get to the 5 months? In those previous attempts, would you say that the politics is what has actually hindered the conclusion of this dispute?
I don't think so.
Saying, there were initial meetings between the county and the workers, and then they did not get to resolve. Why were they not getting resolved?
I would say I do not think that there was politics at the beginning of this. I do not think that it is politicians or political leaders who impressed on the doctors to go on strike. I don't think so. There were, and if you look at the demands, the 6 demands, to some extent you can see there are some, real genuine.
They're logical.
Yeah, genuine and logical complaints that are in there. So I think there were general, just like we have seen, even now we have the lecturers strike, It has been normal in this country to have industrial action. So I think there were genuine reasons. The problem is that I think the county government has not been able to create an environment in which they could sort out that issue and agree on return to work formula.
Why?
I do not know why, but I would say
you just observe.
I would say that it is wrong on the part of the governor to have an industrial action like this go that far. Sometimes you seed some crowds. Like I'm saying, the reason we did not have any industrial action during my time during COVID was because I was seeding some crowds. Sometimes you seed some crowds because of the bigger benefit that arises out of it. So I would say that...
Somebody may translate that to be, you're kicking the can down the road, you're placating them now, and then you pass on the problem, like Dr. Nyoro did. These issues that are here today are not necessarily new. Right? There are some issues that could have been addressed by Nyoro in his administration, or by Babayao or Kafogo earlier, but they were not addressed by those other governors. Now they're landing on this, and Omatangi has decided, you know what?
Not my monkey.
Or you're entrenching now a culture of using industrial action to strong arm administration.
I am not gonna buy.
But if you look at the issues that the doctors are raising, issues such as remuneration or career path. I do not think that you can accuse somebody else because you came in and you found the situation as was that time. So what you are supposed to do is to pick it and move along with it. I have to tell you, the current chief officer of health, Dr. Nyaga, was my appointee. I'm the one who appointed him, and Governor Matangi has maintained him. I had a previous chief of CEC for health. But what I decided to do is to appoint medical personnel to serve as managers, because there is a language I don't understand about doctors. And the chief officer should be able to understand the doctors first and understand me, and then we come up with a win-win situation. So I do not think that there are some problems that you could have, or you probably found 3 years ago. If it was the first year, I would say probably, 3 years ago, you found some problems of non-payment of dues by doctors. I don't know who you can accuse on that. I do not think that, and the politics is not in that direction. The politics is coming in because there has not been working formula between the governor and the rest of the medics.
Let me just ask a little bit linked to what Eric is asking, because I know you've said, well, you don't think it could be that, but by the time you were transitioning between budgeting, disbursement, and accountability, do you think some cracks had begun to show that maybe were inherited? Because you had one of the biggest health budgets, I think, Kiambu. So it might not be so disconnected that some issues were inherited, whether or not you knew, I don't know. But just from your observation, when you were transitioning, do you feel like issues were there on budgeting, on disbursement, or accountability that seem to have cascaded to what we're seeing now?
I think I want to tell you this.
On payment?
On payment, yes.
I want to tell you this. The other chief, one of the items that came in is an item called FIF, Facilities Improvement Fund. That is the money that are raised within the facility. So the patients would come, they pay. That money is referred to as Facility Improvement Fund. Now, at Ashi, what they did was they made it mandatory that the facility will be able to retain and use that money without necessarily the money being transferred to CLF, the County Revenue Fund, okay? Personally, I had started that long before she came in. We had already came.
Dr. Nyoro.
No, there's SHA. Yeah, there's the fund. Okay, SHA. before it came, because one of the requirements, you remember, SHA had three components.
Yes.
Yeah.
Yes.
There is a primary health. But there was the electronic part. But there was also FIF.
Yes.
The Facility Improvement Fund.
Yes.
That made it mandatory for the facility to retain the money and set the money and use the money.
Yeah.
I had already started to implement that. We were among the very few counties. I think it was only Nakuru that was doing it, that were retaining that. Now, on the issue of delays in disbursement, that is normal. Every year, when it comes to June, you probably not get your disbursement in June. You probably get it in September. And therefore, you sit with doctors and you agree on way forward. We had our own internal ways of doing that. We went out and we borrowed some money from banks so that we can pay basic salary. And then when money comes, we pay. So there are certain things that we had already done that were meant at curtailing issues of industrial action and whatever else. So if you are telling me today that we did not have enough infrastructure, if you are telling me that we did not have enough oxygen tanks, because we learned that one of the causes of infant mortality is when the baby is born, the baby may not start breathing immediately. So it is important for you to have oxygen next to the bed. And during COVID, we installed tanks in all these hospitals, which was piped all the way to the bed. So if you can tell me it is an infrastructure problem, I can accept. If you can tell me it is a structural problem, I can accept. If you can tell me it's delays in disbursement, then I can tell you what is happening to the next 46 counties. Okay? Why only in Kiambu? One issue that you have to consider is that the medical department takes a huge proportion of the total wage rate. Okay? It's probably 60%. And therefore, part of the problem that you can see in head side is that, the governor probably sees that an increase of 20% means that you are left without anything, and therefore you can try as much as possible to curtail any increase. But you can't stop it. You have to be able to work out other ways of raising additional revenue.
Is it realistic? No, not realistic. Is it practical to continue retaining the health personnel as employees of counties? The medics have been pushing for a National Health Services Commission. So they're employed by a central entity that then disburses them to the counties.
I think I've said that time and time again, because you see, doctors are very professional people. They've gone to the university for 7 years. Sometimes they do not understand the politics, okay? And like I said, they are such an important service that everything else revolves around health. If you don't get it right, it doesn't matter what else you get right. And I have said that the problem we are having currently in the country is that we have left the medical personnel in the hands of county governors. You have different kind of remuneration depending on the county itself. You have different allowances, you have different terms and all of that. So we may have gone to the same university, we finished the same year with Miriam, but Mariam, but Mariam is in one county and I'm in another one. She's more senior than me. Okay, that does not augur well.
Or we're in the same job grade, but I'm earning more than you.
Exactly. So it is important that we start thinking, because we cannot remove health from, Schedule 4. I do not think that we are talking about not devolving health. I think we have seen a lot of benefits for the devolution of the health sector. What we are probably thinking about is, and maybe we need to look at what happens in other jurisdictions, like the UK. What we are looking at is probably to have a National Health Commission that employs the doctors. They have similar terms, they have similar career path, and so on. But these doctors are sent to counties to be managed and supervised by the governors.
Okay.
So that now with their union and with the commission, the way you see teacher service commission, we don't hear primary schools, having different, terms from one another. That's probably something that we need to think about. But remember also that there has been issues with the health personnel even at the national level. So whereas we are looking at the counties as a problem, we also do have a big problem at the national level.
I'm looking at it from those two angles, from, of course, the issue of staff welfare, but also from a cost issue. Okay, with a small budget that comes to the county and a huge portion of instead of a 70%, 60%, 70% of your recurrent expenditure on salaries is going to just one cadre of staff, then you are bogged down. Because you have all these other services. For example, in Kiambu, during your time, you increase the number of agriculture extension officers. You could only have so many because you have doctors to pay. You can't, So should we also now remove that burden and say that at national level, the issue of payment of doctors stays there? So the money that goes to county is not minus the salaries. It still goes as 450 billion shillings or 500 billion, but for everything else,
national government finds some way to pay
yes,
doctors.
In this 2 trillion shillings that is left at national government, this 200 billion shillings that's left at the health ministry, let it pay doctors.
That is exactly what COG has been talking about. I'll tell you, during our time, we also had another issue. And the issue was on career progression of doctors. Whenever doctors would go for higher degree, masters and whatever, at that point in time, the counties were supposed to continue meeting their salaries. So you may have scholarship, you may get your own personal scholarship, but your salary, because you are on leave of absence, your salary continues to be paid by the county. So we had a problem that we were paying doctors who are not providing services to us. And worse still is once they graduate, they do not have to necessarily come back to a facility. So we had that issue.
And if they do it at a higher salary.
Or they even would prefer that now they go to Kenyatta National Hospital.
You cannot bond them.
Oh yeah, you cannot bond them. I understand that the issue has been sorted out now, that has been taken up by the national government. And I think that is what we need to think about, because when you hear the intergovernmental what do you call it? The IGRTC talking about some functions still remaining within the national government, and yet that service is devolved. We are saying that the national government still continue to maintain a huge budget, okay? And they have devolved this to the counties, and they expect the counties to do everything. I think out of the money that is remaining at the national government level and the Ministry of Health, part of that should go towards, or it may not be whole of it, maybe part of it or whole of it, should go towards funding this health personnel, so that you remove that bottleneck from the counties.
Okay.
It requires to be discussed.
It does.
There's
something, that I'm not sure who it was, but in the bites that we had, someone I'm assuming from the county spoke of KMPDU fees being part of the politics of this whole thing. And that's not something I've heard before. So he said this is actually a stalemate over Kiambu not wanting to collect KMPDU fees on its behalf. Is that, I didn't even know, is that what counties do, or do they collect fees?
No, you know that has happened even at the national government level. Whenever there is an industrial action and a group of people are on strike, there has been tendencies to say we are not remitting, okay, the dues.
Because you're on strike.
Because you're on strike. And, it's a way of making you, because, it kind of...
leverage.
Yeah, it kind of, grinds you to a halt.
Yeah.
Because if you don't have resources, so that normally happens. So I think it could be the same thing that now Kiambu County said, that KMDPU, which is saying that we are going to be dissolved, we are not going to give it money. Okay, so they are deducting, I don't know whether they are paying the doctors, but assuming they are paying the doctors their salaries, which I don't think they are, then they should be deducting part of the dues and then limiting it. But I understand they are not doing that, which is now becomes another cause of action by the doctors.
Just as Mariam is doing the math, Charles Dungo is saying, how long does it take status to get disbursements from Treasury? Is it immediate or comes months later? It makes it seem normal for late disbursement for counties to be normal. When you mentioned that, I just wanted to quickly understand, when you said it's normal, they know that if instead of June, they'll get them in September. Why is that normal?
Well, put it this way. When you listen to CS in charge of Treasury, and whenever there are delays, because there have been delays of up to 3 months, whenever there are delays in disbursement of county funds, he says priority number 1 is paying the debts. Priority number 2 could be capitation. Priority number 3 would be the counties. Okay, so it depends on how much money they have been able to collect at any one point and what their priorities are. And if county disbursement is not a priority, then there are delays in that. Now, specifically on the question that you're asking, end of June is the close of financial year. So everything, if MIS is closed, everything is closed, and you go to July. July, nothing happens because now they are, loading the new budget and all of that. That's a term. I think you've worked there. They are loading.
We've had it.
So they are loading the budget, and the earliest you start expecting your money is end of August, beginning of September. So that's why I said it's not under the Constitution. The county government is supposed to receive the monthly disbursement by the 15th of the following month. Okay, by 15th. So there should never be a delay. But those delays come. And that's why I'm saying, and I can tell you, during COVID, remember, revenue collection was limited because we had closed all the bars, we had closed all the transport and whatever. So there was a very limited amount going to the exchequer. So we used to get delays up to 6 months, 4 months, 5 months. And that is where, I was telling you, innovatively, we are not supposed to borrow by law. We are not supposed to borrow. If you borrow, the Auditor General and the Controller of Budgets will be up in arms. But we used to call a negotiation. You negotiate with a bank, and then they can give you a facility, okay, so that when your money comes, then you can pay. So people could receive, even if it is basic salary, continuously. So these are things.
Getting creative.
Yeah, but on the issue of Kiambu, why Kiambu alone? Why Kiambu alone? You cannot talk about the rate in disbursement. You cannot talk about, I think it's a whole management issue, really.
It is, and there's a comment here that speaks to that. Says Charles Ndungu says, the County Assembly of Kiambu is a replica of the National Assembly. He says, they're puppets of the governor, just like the National Assembly are the president's puppet. But you spoke to infighting there. Are they puppets or it's the exact opposite? And then how does that play into, because I don't think we've seen like that interconnectedness. In my head, it's still Kiambu County versus KMPDU and doctors. I haven't really seen how the county...
The other national leaders. Remember on Sunday here in Nairobi, in Ziwani, the president was there to attend the commemoration of AIC Church's 75 years. Among the people who were present was the leader of the National Assembly, Kimani Ichung'wah, who's a member of Parliament for Kikuyu, which is in Kiambu. And what was he saying about Kiambu? Please, Mr. President, come and sort out our issues. You know, there we have somebody who is not hearing our people. So, like Dr. Nyoro is saying,
it's connected.
All elected MPs from Kiambu County, plus the senator, plus the nominated members who come from that area, are on this side, and the governor is on that side.
On that side.
And in between them is a whole river with crocodiles.
Yes.
The members
and
of
down the river are dead bodies.
That's the unfortunate bit.
Yeah.
You've spoken a little bit to it, but put on your governor's hat again, just for now. What 2 actions would you take? There's politics on one side. There's different allegations going on. KMPDU 139. Kiambu, I don't know.
And Duale has the numbers.
But he doesn't want to withhold. Now you're back. You've been told, come and be interim to Kunashida. What 2 actions would you take? Because I think in all this, and I'm seeing some people commenting about how residents in Kiambu are now beginning to feel it, right?
Yeah.
So what 2 actions would you take to cradle the fact that medics need to be paid, but there's politics, but there's all these things happening? What actions would you take?
Let me tell you, whenever you have a problem outside, okay, and you have a problem inside your house, what you do is to sort out the problem inside first, okay? Then once you have settled the problem inside, you can go out. If I was the governor, the first thing that I would do is to make sure that my house is working. And on the strength of my house working, I can now attack the people outside. I think the first thing that we would do, and because there seems to be a situation where the 2 cannot talk, and that's why I'm saying, is it possible to get an arbitrator? The arbitrator may not be national government, if I was the one to do that. The arbitrator could be Kiambu,
Former governor?
No, not former governor. Forget about former governor.
Okay.
But you know, we have
professionals.
I'll be biased. They'll say I'm biased.
Okay.
But you know, they are
Kiambu professionals.
Yeah.
Kiambu professionals.
Okay.
Or Kiambu church, congregation, whatever.
I was
Okay?
going to church in
Yes, you know, so you bring in those people and say, listen to these people. Listen to what they are saying. Listen to what I'm saying. How can we be able to sort this thing out? So in-house, you sort that problem so that you shame those people outside who are going all over the place, you know, saying that you don't work. Because the problem right now is that you have armed those politicians to attack you more. So the first thing that I would do is to look internally and find a solution within and be frank with myself, and then come and attack those other people and say, I fixed it. So now what are you going to say? It's not going to be dissolved.
And
Okay?
you come holding hands, KMPDU and
Exactly. Forever,
As Dr. Nyoro is speaking like this, I'm remembering that bite that goes, I'm sure you've seen it, of you talking about Muniombe.
Niko na shida mingi. Ni ya kujiletea. Ni ya kujiletea,
We're going to have to do that with you by the after the show. We have to.
You know, what I'm going to do is I have patented that. Anybody using it is going to pay me.
Have you already patented it?
Yes, I'm patenting. No, I have not, but I'm
Okay.
patenting it.
What was going on then?
Yes.
No. That's, Eric, that's a long story. Okay, you remember very well that myself and Governor Itito came together on the understanding that we are going to have a working formula, just like, Igade and Sonko and whatever. But things changed along the way. And at one point, the governor said, look at your job description. Do what your job description says. There's nothing like, that united for Kiambu, and there were quite a number of issues. My office was, walimwaga maji kwa ofisi yangu. They wanted to snatch my car and a lot of that because I honestly decided not to cooperate. And it was in one of those moments that I felt these were, personal problems. These are problems I brought to myself.
Ukaitisha maombi.
Yeah, nikaitisha maombi.
But
it was a political way of communicating because it worked. It was a political way of communicating and saying, you guys, you cannot be just exactly. In fact, we should say Kiambu yombewe. Iko na shida ya kujiletea. Yeah, the same way. Now, once you bring that to the limelight, then people started saying, no, this thing cannot continue. So thereafter, things started to improve.
So if you look at Kiambu today, because, and you can correct me, the kind of confidence that the governor is speaking with and going around Kiambu with, he seems to feel that he has the ground with him. He has the people with him. And that everybody else is actually speaking anti-people. Is that the truth? Is that the case? Is the governor still as popular with the people?
I don't know. We need to do some opinion polls. But in this country, there's something called empowerment. And You have seen Empowerment Brigade going to all over, doing empowerment. And I think one of the things that the governor has managed to do is to do empowerment. He's been reaching out to the people with chicks and piglets, and it gives you an opportunity to talk to people. You know, normally, you know, our people are in such a dire need that if you call them to give them a pen, they all come. And you have an opportunity to talk to them. And, you know, if in my house we did not have food and you have given me maybe 200 or chicken or whatever, I value that. So those forums that the governor has been doing, which brings him closer to the people, has created the impression that he is popular and he's with the people. But people are starting to question, okay, you gave me some chicks, you gave me some piglets, you gave me some 500 shillings, but when I got sick, I got to the hospital and I died. Okay? People are starting to question the bigger picture. People are starting to question the whole issue of either tokenism or transformation. Okay? Because even the empowerment brigade that we are having, what we should ask ourselves as a country is it transformational? If you go to this county and do this, what is the theory of change? Okay, so this will lead to that, and it will, and they make people better off.
And in the end,
but if you just come in and you find there is fire and you put off the fire and the fire starts on the other side, it doesn't help. So people are starting to question the whole aspect of tokenism and transformation. And I think in a county like Kiambu, what we should be looking at is more transformational. Okay, so when we give agricultural inputs and whatever, what is, like I said, what is our theory of change? That you do this so that will happen, and in 3-4 months this will have happened, and so that should be the way. Give them, show them how to fish, and they will be able to fish, you know, for themselves. Don't give them fish every day.
But then, are the people of Kiambu interested in learning how to fish? Okay, don't answer that directly because you'll put yourself in the Let me put it this way. They had the first governor, and then they voted out the first governor. They voted your team in. And then when your governor was impeached and you took over, they voted you out. They voted this current governor in. And the talk is, you know, voting out. Voting out to me is eating the fish. Voting in is learning how to fish. Right? What would it need to happen in Kiambu, and just across the country, from your experience as a politician now, so that people start thinking, I'm voting in a leader?
Not voting out.
You know, I think the problem we've had is that, and let me tell you, Kiambu would have been the least county. I would have expected this kind of problem. Because even 2013, when I first contested, we had Kiambu professionals who had developed a strategic plan on what needed to be done. You know, Kiambu is the only county which is not a city, but it has a city within itself, Tatu City. Now, if you look at the fundamentals of Kiambu,
and Northland City,
you know, Northlands, you know, even now vehicle assembling in Thika, computer assembling, business process outsourcing centers in Tatu City. If you look at all of that, you know, tea, coffee, macadamia, we are the biggest dairy producer. We produce the highest quantity of milk in this country. If you look at all of that, you would probably expect that Kiambu people would be looking for a manager for their resources, okay? In other words, they would probably start with a job description and say, we need somebody to do A, B, C, D. And then they would go out and look at the applicants the same way corporate operates and pick somebody who can be able to do A, B, C, D. Unfortunately, we don't do that. And that's why I'm saying Kiambu should be the least country to have, you know, kind of problems that we are going through. Right. Because we have the personnel, we have, if you look at the history of the county, we have the resources. And I think it's time now, and we are hoping that Gen Zs will help us to think through this. It's time now that we change that and we start with a job description and then look at the person to come and, you know, implement that job description. It will be the same for the country. You see, in this country, the people who are most popular people who unfortunately cannot even be able to manage even NCDF. These are the people, you know, our people align themselves with those people.
Sorry,
Let's
we're out of time.
Yeah.
I had so many other questions. I was like, if
Part
we're
two.
teaching the men how to fish,
Yeah.
quickest ways to increase on-source revenue in Kiambu in 30 seconds.
Well, on-source revenue is a double-edged sword.
30 seconds, yes.
Yeah, double-edged sword.
Yes.
Because it depends on where you are getting it. If you want to get it more, you'll be hurting the business and you'll be hurting the business people. You have to balance it. So you cannot say you are successful because you have raised the biggest on-source revenue. It depends on where your on-source revenue is coming from.
Where it's coming from.
Yes.
Thank you so much.
Thank you. I know all these conversations today needed part 2, 3, but thank you so much.
Fixing the nation, eh?
Fixing the nation. Thank you to our guests. Your World is up next. Mwikali, Winnie, both there. Philo will tell us. And for Vibe Shift, it's Brian Aseli and Claudia Naisabwa. From me, Janet Bogwa. From Eric Latif, Mariam Bishar. Thank you so much for staying with Fixing the Nation. We'll see you back here tomorrow morning.